and South Carolina Congresswoman Nancy Mace. All right, Nancy Mace, I'm going to start with you. I say these things, I say we've got to fight back, and people say, well, how do you fight back? What do you do? You showed us this week. You put out a video sticking it to Nancy Pelosi. Tell us your position on fighting back against this madness.
Well, I walked into the office, in my D.C. office on Thursday morning, to learn that Nancy Pelosi had told and directed the Capitol Hill police to arrest people who are visiting the Capitol and our staff, to be arrested if they were not wearing a mask. And I totally lost it. I absolutely lost it. It is authoritarian and it's wrong. And if you want to prove that vaccines have efficacy, the last thing you need to do is message that vaccines don't work by telling Americans that they might be arrested and that they'll have to wear a mask outside to protect the unvaccinated. I had a really terrible bout of COVID-19. I had long COVID, and I've been, pushing and encouraging people to consult with their their doctors and their physicians to get vaccinated to help put a stop to this thing. But I'm old enough to remember when President Trump, when he was president, and it was the left calling him authoritarian. Well, this is the very definition of authoritarian.
And I was interested in one of your colleagues, Dan Crenshaw, said, very directly, said, look, just ignore them. Just ignore all this stuff. And we hear this term civil disobedience a lot in this debate. And I know our audience feels incredibly strongly about this, whether they live in and I think it's important here because, obviously, it depends where you live. In South Carolina, in your state, there's a ban, I think, on schools imposing these mask mandates. So, different places have different rules. But generally speaking, I think there's a proud and noble tradition of refusing to obey unjust laws. And I think that also applies to unjust rules made by unelected bureaucrats, don't you think?
Oh, absolutely. And this is really about stoking fear and a fiasco rather than facts. The CDC data that they've been using last week is total bunk. And in fact, it was a study from another country not using vaccines that we used here. I had 4 words for Nancy Pelosi last week. It was come and get me. And I do believe that. And you saw Republicans, because masks are mandated on the House side of the chamber, but not on the Senate side in their chamber. And you saw that civil disobedience peacefully trying to prove the hypocrisy and the stoking of fear. This is not based on science, and it's wrong. And we need leadership in this country. Our nation is divided, and this is not the way to encourage people to get vaccinated. And anyone that's watching tonight can go to Nate Silver and 538 and look at the statistics. It is people in low-income areas that are not getting vaccinated. We need to ensure that we're going into those areas, that we have access to vaccines, and we're encouraging and communicating and educating those areas so that we can put a stop to the Delta variant and any other variants that come forward now and in the future.
Exactly. Now, Dr. McCarry, I don't expect you to weigh in on the politics of all this. You're here for your medical expertise. But one thing I noticed, and I wanted to talk to you about, as soon as I read it, your brilliant piece in the Wall Street Journal, a number of really important points there. One of them that really stood out to me was your criticism of the CDC's own data collection. Nancy Mace mentioned the poor data there. But this goes right back to the beginning of the pandemic. We were here over a year ago saying, publish the details of who exactly is really getting into trouble with this disease so that we can really help people prepare. But, the comorbidities, all of that. You wrote that they still aren't doing that properly.
It's inexplicable with 21,000 employees how the CDC has not investigated the reported 335 deaths. They can't even tell us how many deaths have been in kids under 12. It's probably about 100 to 200. And they can't tell us if they had a pre-existing medical condition or were healthy. And Dr. Walensky's been asked several times, were any of those kids healthy? And she says she doesn't know. How do you not know when we're imposing tremendous restrictions on 50 million kids? And even this week, announcing with such certainty, with such an absolute nature and fervor that every child K through 12 needs to be masked, even if they're vaccinated, even if they're in a low outbreak community in America, despite the fact not a single study has ever shown that masks work in kids. We're extrapolating from adults, but if no healthy kid is dying and the risk is very slow. By the way, there's more kids with RSV in the hospital right now than with COVID infection. That's an infection that causes the common cold. Where's the data? It's remarkable. $42 billion is spent by the NIH last year, and not a single study on masks in kids.
I mean, why do you think that is? I mean, why is the CDC used to be held up? I mean, you hear it over and over again, the world's premier public health agency. It seems to be operating as a shambles through this pandemic.
I feel as if they've already decided that every human being needs to be vaccinated, regardless of any other factor, regardless if they're extremely low risk, regardless if there's complications from the second dose of the vaccines in teenagers, regardless if they have natural immunity. It has been a top-down decision early on that that is what the directive is going to be, and they are sticking to it. And even she suggested in the interview with Bret Baier that kids will need to get vaccinated under 12. We haven't even seen the data yet. The trial is not even read out yet. How do you make that conclusion already as your baseline assumption?
Yeah, it's really shocking, actually. Jason, what's your reaction to all this?
Well, I think Dr. McCary makes a very valid point. I want people to digest it, and that is they're making the political decision before the data's in. The way to properly do this is to show the public the data, let the medical professionals across the country examine that data, and then the CDC can come in a couple days later and say, based on this data, you can all see why we're making this decision, but it's quite the opposite. And the problem particularly with Dr. Fauci is he's so invested in protecting now himself and what he said. And he said multiple different things about the same topics that now you need to dismiss him. He needs to be fired. He needs to go. Nobody trusts Dr. Fauci. And he has a political, personal agenda to protect his reputation. And I think if President Biden wanted to try to do the right thing, he would fire this guy and get rid of him and put somebody else in that America could believe in. But right now, you really can't. And to Nancy Mace's point, to the Congresswoman, remember, Nancy Pelosi was making this directive. I don't believe there's a direct rule that gives her this. But at the same time, she's saying she's going to arrest people like Nancy Mace, who already has some immunity to it, evidently having gone through it before, and her staff. It was Nancy Pelosi who posed for a photo and took off her mask for a photo opportunity. How come she wasn't arrested? She doesn't get to live under different rules than everybody else, but that's the way the Democrats and Nancy Pelosi roll.
And Dr. McCary, what are they doing with this, the panic they're creating over the Delta variant? As you know, we've got good news here. We saw it in the UK, the decoupling of case rates from hospitalizations and deaths. It's not the same pattern we saw before. So why are they stoking this panic?
People are conflating two entirely different things happening right now. One is breakthrough infections where you test positive after you have immunity. Those are often asymptomatic, and sometimes they're mild. They're never severe or deadly cases. The other thing that's happening is the virus is ripping through in a more contagious form through that 10 to 20% of the adult community in America who has not yet been vaccinated and they don't have natural immunity. That's where we should be spending our effort, encouraging that last segment of the population where there's a real risk to their own health, not arresting people who are vaccinated and forcing young kids to wear masks. We need to focus on that 10 to 20%. By the way, the biggest barrier to vaccine hesitancy in the United States right now is the U.S. federal government. The FDA has not issued full approval despite an impeccable safety profile.
And last quick word, Nancy Mace, I just want you to get the broader picture. It's not just on the pandemic, it's right across the board. It's this mixture of incompetence and top-down authoritarianism that's so toxic.
It's shocking, but it's very scary as well to see this happening. Literally, I have a front row seat to seeing this authoritarianism happening in our country. And I learned a few days ago that if you are a tourist and you're going to Mexico and trying to re-enter the United States and go home, you're required to test negative for COVID-19. And look what's happening at the border. We're allowing thousands of people to come over across the border every day. No masks, no vaccinations, no testing. This isn't putting our citizens in our country first at the moment, or our kids. And let's look at where the hot spots are. Let's go in and fix this. But no one's shutting down the border. And I saw Lance Gooden the other day tweet, when is the CDC going to recommend shutting down the border to stop these hot spots and stop the Delta variant? It's so idiotic.